everyone, this video will be about femur, the strongest and the longest bone of our body. As it is a long bone, so it will have a upper end, lower end and a shaft. So let us see the side determination of the femur. For the side determination, hold the femur vertically such that the upper spherical head should face medially and upward. The shaft of the femur, the anterior shaft of the anterior part of the shaft is smooth and the posterior part has distinct lines. So for the side determination, the distinct line should face posteriorly. The two condyles must be directed downward and lie on the same horizontal plane. So for the side determination, 3 points must be remembered. That is, the spherical head must face medially, the posterior distinct lines and the condyles downward. And to hold the femur in its anatomical position, balance the neck of the femur with the index finger. So this will be the anatomical position of the femur. Before starting the features of the femur, please note that I am not holding the femur in its correct anatomical position or in correct side determination just for teaching purpose. But in front of examiner or in front of professor, you must always hold the femur in its correct side determination. Femur has an upper end, a long shaft and lower end. The upper end consists of head, neck and two trochanters, greater trochanter and lesser trochanter. Head is spherical. It articulates with the acetabulum to form the hip joint. A rough pit is present which is known as the fovea. The neck connects the head with the shaft. It has two borders and two surfaces. Upper border, lower border, anterior surface, posterior surface. The upper border is concave and it meets the shaft at the greater trochanter. The lower border meets the shaft at the lesser trochanter. The anterior surface meets the shaft at the intertrochanteric line and the posterior surface meets the shaft at the intertrochanteric crest. Now the two terms comes as intertrochanteric line and intertrochanteric crest. Intertrochanteric line is present on the anterior side of the femur. It is present between the anterior surface of the neck and the shaft. And the intertrochanteric crest is present posteriorly. It is present between the posterior surface of the neck and the shaft. And a round elevation is present on the intertrochanteric crest. It is known as the quadrate tubercle. Now let us move to the trochanters. There are two trochanters, greater trochanter and lesser trochanter. The greater trochanter is large and prominent and it is present between the junction of the neck and the shaft. The greater trochanter has an upper border, apex and three surfaces, anterior surface, lateral surface and medial surface. The apex is the posterior part of the upper surface. This is the upper surface and the posterior most part of the upper surface is called the apex. The anterior surface is rough. The lateral surface is crossed by an oblique line. So this is the oblique line. It is directed downward and forward, and the medial surface has a fossa known as trochanteric fossa. So this was all about the greater trochanter. There is nothing much about the lesser trochanter. It is just a prominence present medially and backward. The shaft of the femur is divided into three parts: the upper 1/3, middle 1/3 and lower 1/3. Now let us first see the middle 1/3 of the shaft. The middle 1/3 of the shaft has three borders and three surfaces. Three borders are medial border, lateral border and posterior border. So this is the posterior border. And three surfaces: anterior surface, medial surface and lateral surface. So the anterior surface is between the medial border and the lateral border. The medial surface is between the medial border and the posterior border, and the lateral surface is between the lateral border and the posterior border. The medial and the lateral borders are rounded and ill-defined, but the posterior border is distinct, and this distinct line is known as the linea aspera. Linea aspera has a distinct medial and lateral lips. So this is the medial lip of the linea aspera and this is the lateral lip of the linea aspera. In the upper one-third of the shaft, the two lips of the linea aspera diverge and encloses an additional surface. Previously, in the middle one-third, we had seen that there are three surfaces. But in the upper one-third, there is an additional surface known as the posterior surface. So altogether, there are four borders and four surfaces. Four surfaces as anterior surface, medial surface, lateral surface, and posterior surface, and four borders as medial border, lateral border, spiral line, and the lateral lip of the gluteal tuberosity. Similarly, in the lower one-third of the shaft, the two lips of the linea aspera diverge and encloses an additional surface known as the popliteal surface. Similarly, there are four borders and four surfaces: anterior surface, medial surface, lateral surface, and popliteal surface, and four borders: medial border, lateral border, medial supracondylar line, and a lateral supracondylar line. Now let us discuss the lower end of the femur. The lower end of the femur has two condyles, lateral condyle and medial condyle. The two condyles anteriorly are united, but posteriorly there is a notch called as the intercondylar fossa or intercondylar notch which separates the two condyles. The lateral condyle is flat and is in line with the shaft. It has a prominence known as the lateral epicondyle, and a popliteal groove is present in the lateral condyle. The medial condyle is convex and its most prominent part is known as the medial epicondyle, and adductor tubercle is present on the medial condyle. This adductor tubercle is an important landmark because the epiphyseal line in the lower part of the femur passes through the adductor tubercle. Now let us start with the attachments of the femur. First, let us discuss the attachments on the upper end of the femur. The upper end of the femur has a greater trochanter. It has the following attachments. The greater trochanter has an apex to which the piriformis is inserted. The gluteus minimus is inserted on the anterior surface. The gluteus medius is inserted into the lateral surface, and on the medial surface, obturator internus with the two gammae, gamellus superior and gamellus inferior. These three muscles are inserted into the medial surface, and obturator externus is inserted into the trochanteric fossa. As you can see in the diagram of the hip joint, there are two gamellus, gamellus superior, gamellus inferior, and between the two there is obturator internus. Then all the three muscles are inserted into the medial surface. Above it is the piriformis, which is inserted into the apex. Then obturator externus is inserted into the trochanteric fossa. Then gluteus medius and gluteus minimus. Gluteus minimus is inserted into the anterior surface and gluteus medius on the lateral surface. So this was all about the attachment on the greater trochanter. Now about the lesser trochanter, two muscles are inserted, psoas major and iliacus. Psoas major is inserted on the apex of the lesser trochanter and iliacus is inserted below the apex of the lesser trochanter. Now about the intertrochanteric line and intertrochanteric crest. As you can see in this diagram, the capsule of the hip joint passes through the intertrochanteric line. So intertrochanteric line provides the attachment to the capsular ligament of the hip joint. There is an additional ligament called the iliofemoral ligament, which is from the ilium of the hip bone to the femur. It is divided into two bands, the upper band and the lower band, and both the bands are attached to the intertrochanteric line. The upper band in its upper part and the lower band in its lower part. So intertrochanteric line provides attachment to the two ligaments, the capsular ligament of the hip joint and the iliofemoral ligament of the hip joint. And about the quadrate tubercle, which is present on the intertrochanteric crest. This quadrate tubercle provides insertion to the quadratus femoris. Before discussing the attachments on the shaft, please note that there are two groups of muscle, that is the vastus muscle and the adductor muscle. The vastus muscle are vastus medialis, vastus lateralis and vastus intermedius, whereas the adductor muscles are adductor longus, adductor brevis and adductor magnus. In the shaft of the femur, the vastus muscle have the origin from the shaft of the femur, whereas the adductor muscle have insertion into the shaft of the femur. So the vastus intermedius gets origin from the anterior surface and the lateral surface, and below the vastus intermedius there is the origin of articularis genu from the anterior surface. In the posterior surface, before discussing the attachment, let me name all the muscles present on the posterior surface. So if this is the lateral side of the femur and this is the medial side of the femur, then the lateral side of the femur has the lateral lip of linea aspera and the medial side of the femur has the medial lip of the linea aspera. Starting from the lateral side, the muscles are vastus lateralis, and then is present biceps femoris, and that to the short head, because biceps femoris has both short head and long head. Short head of the biceps femoris has an origin from the posterior surface of the femur. And then more medially is present the adductor muscles. First the adductor magnus. Adductor magnus is present, and then adductor brevis is present, and then adductor longus is present. And then most medially is present the vastus medialis, and above the adductor longus is present the pectineus. So these muscles, that is the pectineus, adductor longus, adductor brevis, adductor magnus, all have the insertion, and the muscles vastus medialis, vastus lateralis and short head of the biceps femoris have the origin. After knowing the names of the muscles, let us discuss on the femur. So this is the medial lip of the linea aspera and this is the lateral lip of the linea aspera. Starting from the lateral side to the medial side, here comes the vastus lateralis, then biceps femoris short head, then adductor magnus, and then adductor brevis, adductor longus, and above the adductor longus is the pectineus, and then vastus medialis. The insertion of the adductor magnus is to be noted that adductor magnus insert into the linea aspera and then the medial supracondylar line and then to the adductor tubercle. And the other muscles name is to be remembered serially from lateral to the medial side, but have a special attention towards the adductor magnus insertion. Mention all the adductor magnus insertion points. And then into the lower end of the shaft of the femur, the lateral supracondylar line gives origin to the plantaris and the upper part of the lateral head of the gastrocnemius, and the medial supracondylar line gives origin to the medial head of the gastrocnemius. Now the last part of the video is about the attachment at the lower end of the femur. The lower end of the femur consists of the lateral condyle, the medial condyle and the intercondylar notch. The lateral condyle, in the lateral condyle is present the lateral epicondyle and the popliteal groove. So in the lateral epicondyle, there is the origin of the lateral head of the gastrocnemius, and in the popliteal group, there is the origin of popliteus muscle. The medial condyle has an adductor tubercle which receives the insertion of the adductor magnus. So this was all about the muscles, and the ligaments at the lower end of the femur is described in the diagram of the knee joint. So this is the lateral epicondyle, this is the medial epicondyle. The lateral epicondyle has the fibular collateral ligament which gets attached to the fibula, and the medial epicondyle has the tibial collateral ligaments which is attached to the tibia. There are two other ligaments known as the anterior cruciate ligament in the lateral epicondyle and the posterior cruciate ligament from the medial epicondyle. So this was all about the femur, side determination, anatomical position, features and attachments.